So, good morning, good afternoon, good evening, wherever you are. Thank you so much for joining us. I'm so excited to have Dr. Alicia McCubbins back. We've had a couple of great conversations in this forum in the near recent past. Dr. Alicia is a naturopathic physician at Vital Health, functional medicine doctor. She sees patients in all aspects of functional medicine, but particularly awesome at things like hormones and fertility, women's and men's health, and I mean, what don't you do? Gut health, I mean, connective tissue problems. There's so many things that you're so good at, and you have such a unique perspective that you bring to your patients, and they love you so much, and so do we. So thank you so much for joining me today to talk about this really interesting topic.
Oh yeah, I'm excited to talk about anything to do with rhythms, but then also with you, because as I said, I always learn from you too.
We just like to hang out. That's the truth.
Yeah.
So this is kind of an interesting topic, and one that we have been hearing from not just patients in our practice and doctors in our practice, but also friends and family outside in the real world. That this time of year, summer, we tend to struggle a little bit more with our rhythms and recognizing our natural way of being in the world around rhythms and routines and things like that. And part of it is related to the longer days, early sunrises, late sunsets. So the day becomes very long. And in some people's lives, that can become a little bit unwieldy. But it's also in families where there's now, maybe there's children that are out of school and lots of travel, lots of social engagement. And so there's a umpteen gazillion ways to get off track, right? So with that in mind, I thought we would start talking about some of the biological rhythms that we have in our bodies that are the underpinning to why we have rhythms in the first place. So the one that you and I know so much about and spend a lot of time talking about is cortisol. So let's talk about cortisol first, and let's talk about what it is, how it's rhythmic. Let's just kind of break that down.
Yeah, when I think of rhythms, this is the first hormone that really governs so many other organ systems in the body. So it's an easy place to start.
Totally.
With the simple thought of the circadian rhythm, right? Like this is what our body's naturally attuned to with sleep-wake cycle. And generally what is triggering that is cortisol. Cortisol spikes when you wake up. So it's your internal alarm clock. And then it should slowly come down and bottom out at the end of the day so you can go to sleep. So of course, when someone's complaining about sleep or energy being an issue, we're looking in at cortisol rhythms. But we have to also recognize how many things influence cortisol. And it's not just the sun. Yes, that is a big part of it, but also, stress, lifestyle factors, food, glucose, blood sugars, all that kind of thing. So yeah, it's a very complex discussion with something that's so simple as how are your cortisol levels?
Yeah, totally. Well, and I think the other thing that I find sort of not so straightforward on this topic is that cortisol has become a little bit of a buzzword. It's like cortisol stress, and then people sort of put those two things together. And what I think people don't necessarily realize is that we want cortisol actually as a very valuable hormone. Without it, we are really so unwell, quite unhealthy.
Yes.
And so we want cortisol to be high when it should be high. We want cortisol to be low when it should be low. And that flex is happening every 24 hours, as you described, high in the morning, low at night. We want that rhythm to be established. And so there's behind the scenes, there is a natural rhythm that is happening regardless of your stress levels or what's going on in your life. And I think the goal with rhythms on our own lifestyle is to not get in the way of that.
Right.
Right.
And support them in the ways that we have control. So stress is going to happen all the time.
Yeah.
You can't control stress. You can control maybe how you respond to it, the choices that you make, when and how you eat. Again, that's such a big one.
Yeah.
But you also can think about how that influences other things. So like you said, not having enough cortisol, that is usually a sign of a very loose term called burnout. But I'm also seeing it when there's immune suppression, right? So in the world of COVID, what we've seen in the short term is people stop making enough cortisol. It kind of flatlines for a short period of time. And so the goal of the immune system is still to go again and support your adrenals or your cortisol rhythms. But I also want to pay attention to like how that rhythm influences other rhythms like hormones and things that maybe don't have a very specific morning to night rhythm, but like even over the course of a month.
Yeah.
And
Yeah.
so that's a big picture too.
Talk about, and I want to come back to, so don't let me forget, I want to come back to the idea of eating for, yeah, write it down, eating for optimal cortisol, because you mentioned that like a
Hmm.
few sentences ago, you talked about that. I'd be really interested to hear your input on what that looks like for you, or what you think
Hmm.
about as a naturopathic physician,
Yeah.
how it works. But since you introduced the topic, I'd love for you to talk a little bit about women's rhythms, cycles for women who do cycle. I'm out of that club now, thankfully. Um,
Congratulations.
I earned it.
Yeah.
For women who do cycle, and then a little bit of maybe about how cortisol and estrogen progesterone in the normal menstrual cycle, kind of how that works. How do those rhythms intertwine?
Yeah. So I'm such a visual person. Before this meeting, I was like, oh, I got to find that my favorite graph, the one that shows all the rhythms of estrogen,
Yes. Oh, I
progesterone, and
love that
even testosterone.
one.
Oh, I love those. And because again, it's reminding you of how deeply connected all of these different rhythms are to each other. Like they all rely on each other. And they're all going back to the brain communicating well. And so, yeah, when it comes to like, let's say menstrual cycle rhythms, if cortisol is not well regulated, the downstream effect of that is, the body's very attuned to saying, well, geez, cortisol is a priority. It's my fight or flight. It's my survival mechanism. If I'm stressed all the time, I need to make more of that.
Yeah.
But downstream, that's going to compromise the production of then progesterone, DHEA, estrogen, testosterone, and then of course, all kinds of
Yes.
downstream effects. So yeah, someone with irregular menstrual cycles, like maybe 26 and 40 days and all that,
Mhm.
can still go back to their day, night, sleep, wake, cortisol rhythms.
Yep. Yep. And how important that is. People tend to jump to, oh, I want to fix my estrogen and progesterone, which of
Hmm.
course is important and doable,
Hmm.
but not understanding the cortisol picture, not just ignoring that. Which, obviously in traditional healthcare, nobody talks about cortisol at all,
No,
unless you're an endocrinologist and you're dealing with the extreme
and
Cushing.
that's not for functional. Yep,
No,
disease or not.
yeah, exactly, diseases. But just acknowledging the importance of cortisol and understanding how it impacts all the hormones, can really make. I mean, sometimes just dealing with that and completely corrects those menstrual irregularities, right?
Right.
Yeah,
And I'm not going to fix hormones if I'm not thinking, well, what's long term? Does that mean you're going to be stuck on these supplements or meds for long term just
absolutely.
because? Yeah.
Yeah,
So,
yeah, absolutely. So, and I also want to just say, like, honoring those rhythms, right? There's an inherent gift in them, which I think is hard sometimes when you are struggling with, menstrual problems or,
mhm.
imbalances in the hormones. But there is a gift to the health of that, and the fact that estrogen and progesterone for women are so healthy to have in the body, the effects that they have on our physiology and our bone strength and our heart health and our brain health, you know, so we don't want to again pathologize everything.
Right.
Talk about like these
No.
rhythms are really good for us.
Exactly.
I
And
would,
so I think that becomes relevant when we look at the objective, right? So it's really nice to have tests that look at all of these different hormones that are in rhythm, but remembering that certain times of day is best for testing these things or certain times
yeah,
of month. And so I get really specific about when we're doing blood work.
yeah,
And then having the time and the time of the month and all of that in mind in order to assess those. And so my optimal ranges all vary according to those things. But if you look at a lab, if you ask your doctor about estrogen, progesterone, and all that, these ranges are
I
huge.
know they really are.
And so then they're like, your hormones are normal. It's like, oh.
Oh no, 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 no.
let's really like consider the context. I mean, even cortisol, like the range is
Yes,
huge,
yes.
but you have to think about the time of day that you're testing it. So that's
Oh, that's so important. That subtlety is, I think, what we do so well in functional medicine is really
Mhm.
understanding physiology and not just looking at the lab result and looking at the reference range and pronouncing someone normal. It's like, no, normal or abnormal in the context of other variables, right?
Mm-hmm.
Time of day, the person, their clinical picture, what medications and supplements they're taking,
Yeah.
the whole thing.
Did you
Um,
eat?
yeah, exactly. So let's go back. I've got so many, like my brain is just going in so many different directions, but I want to like, okay, stay focused, Mullen.
Yes.
I want to go back to eating for cortisol. Eating for
Yep.
adrenal health is probably the better way of putting it. How
Mm-hmm.
would you say, how optimally, how would one eat when they are working on trying to support their adrenals?
Well, you got to think about the relationship with cortisol and blood sugars. So when you wake up in the morning and cortisol is supposed to peak, you haven't eaten for at least, well, hopefully 8 hours.
Yes.
So that's the lowest your blood sugars are going to be in the day. That fasting blood sugar, lowest of the day.
Mhm.
Cortisol should be the highest.
Mhm.
That polarity is something that we keep in mind when thinking about how someone is, symptomatically responding as the day goes on. And so we eat, blood sugars come up a little bit, cortisol comes down a little bit. And that follows the trend as the day goes on. Now, most of us can relate to the idea of hanger, as the day goes on, and all of a sudden you get, yes, like irritable, shaky, headache, dizzy. I mean, there's so many symptoms that go from having low blood sugars. That's also your cortisol creeping up. So that's a stress response. So the idea of trying to eat fairly regularly without allowing yourself that stress response is a great way to also address and prevent diabetes.
Right.
Blood sugar dysregulation is highly entwined in cortisol dysregulation.
Right. Right. Yes.
So that's a big part of like, how do we support that? But then also being more specific to what kinds of foods are going to be supportive as the day goes on to cortisol. It's protein. I don't really prioritize any specific food other than just saying if every time you eat, protein is number one, complement it with veggies and whatever, but that should help with blood sugar regulation and then therefore cortisol regulation.
Absolutely. Yeah, that's so important. And the fact that so many of our neurotransmitters, which have a piece of the biology of our behavior, are based on amino acids, which are part of protein. All of that just makes sense then. We have hormonal construction and then we have neurotransmitter construction. And we're not just dealing with our bodies all day long, we're dealing with our minds too, right?
Yes.
Yeah. So I love that. And it's not necessarily that we all need to eat steaks. We can talk about vegetarian proteins. It doesn't necessarily
Yeah.
have meat, whatever
Yeah.
your food choices are, your food ethics are, it doesn't really matter. But yeah, that's important. And I think a lot of us, I'm guilty of that, don't prioritize protein as much as we probably should. Most of us are deficient.
Yes. And the reality is when your cortisol is rising, your blood sugars are lowering, what's fast? More
Yeah.
often than not, it is carbohydrate driven. And that's how our food systems work. That's how we're marketed to. Snacks are usually pretty high in carbs. And
Yeah.
the last thing we need is to spike blood sugars and
Exactly. You're chasing your basic. And sometimes, obviously it's the right thing if you're bottoming out with your blood sugars to grab a simple carbohydrate, but you'll get more sustained normal levels of glucose blood sugar if you couple that carbohydrate with some protein or fat, just to kind
Exactly.
of insulin response. Yeah, so that's really helpful. um, I want to talk about sort of the sister hormone to cortisol, the mirror hormone, which is melatonin.
Yeah.
Is another rhythm that's going on and that can be easily disrupted. I know this is one of my big challenges in the summertime because of light being so early and so late. So talk a little bit about melatonin rhythms, if you wouldn't mind, and how people can work on, getting how quickly we get off base with respect to melatonin in the summertime.
Yeah. A lot of people think of melatonin as that like first line of therapy for insomnia.
Yeah.
But why? I mean, yes, it's the opposite of cortisol. So when cortisol comes down, melatonin comes up. And then in the morning, when you produce cortisol, that's inherently dropping melatonin.
Yeah.
Hopefully, because melatonin is a hormone that needs to be broken down in the liver. So if there's any chance that you're not waking up and you're kind of groggy without taking melatonin before bed, it could be that your liver needs a little extra support in breaking that down. Melatonin is sold from anywhere from like 1 milligram, and sometimes people are taking up to 50 milligrams for reasons of like not for sleep, but maybe more as antioxidant therapy. Uh, it's interesting because our bodies physiologically don't really make more than 1 milligram.
Yeah, we don't make a lot.
So when we're pushing it with supplementation, like 3, 5, 10 milligrams before bed to work as a sedative, it begs the question of like, do you really need more melatonin, or do we need to work on those lifestyle factors that are influencing cortisol and melatonin relationship?
Right.
In our household, it's a little easier or we make it easier in the summer for us by making sure the entire room is completely black, like
Yeah.
no night lights, no alarm clocks. There's
Mhm.
no light in our room because melatonin is produced in response to complete darkness.
Yes.
This is where when you go back to like those primal ideas of how were we operating in our rhythms before technology and all of that, you look at how the pituitary and pineal and hypothalamus glands in the brain work. They are very deeply related to your light exposure. And
Absolutely.
so when light comes in, yeah, it's going to trigger some hormone production that you may not want if you don't want to wake up.
Well, and the fact that they're positioned literally right behind the eyes. I mean,
Yes.
they're essentially behind your eyes. It makes sense that your eyes are the portal for that information, and that all of those structures would be right there from an
And your eyes are
anatomy.
technically an extension of your brain. Like that.
Exactly. They're just parts of your brain that are sticking out into the world. There are antenna, right? Like,
Yeah, yeah.
but yeah, I think you make a good point. So even if you can't, darken your room with really high end shades or whatever, you can always wear an eye mask. Just in that, and not being on devices late at night.
Blue light. Yeah.
Right? I mean, that's probably our biggest downfall, because we are still those humans from 1,000 years ago. We are still those
Mhm.
humans. And what we do to ourselves, and this is where I fall down, is I'm on my computer until 10 o'clock at night.
Right.
And that's, light going directly into my face, as opposed to maybe reading, which the light is behind, maybe a little bit better. But I think that that's really a tough one for a lot of people, is we just don't realize how important that darkness is.
Oh yeah. And yes, I am such a scroller at night. I mean, I'll do it until my eyes get tired. And I follow what you recommend. So one thing that I do think is advantageous is my phone never goes off of the blue light shade. I always have the blue
Oh, that's
light
interesting.
turned off. So, people like when I'm driving through the drive-through will be like, "Why is your phone yellow?" I'm like, "Oh yeah, I didn't even notice that."
Oh, because it's always like that.
Yeah, I just
Oh,
keep it on there so that it's less blue light exposure.
that's
I
a good idea.
mean, we're all figuring out how that is really stimulating, particularly for kids. We're seeing a lot of issues with kids with blue light late in the evening, of course.
Yeah, they spend so much time on devices.
Yeah.
It's the way of the world. But there are the little things, like
Yes.
little subtle things that you can do to, decrease the impact of that,
Hmm.
without crawling back into the cave and
Yes.
all the electronic devices, which is tempting.
Right. No, yeah.
So we have cortisol, we have melatonin, we have estrogen, progesterone. Of course, we have other hormones, testosterone in men, which is much less cyclical,
Mm.
and has less of a sort of a rhythm in and of itself.
That one's more during like the day.
Yeah,
So it's when we test it, mornings are better, and like
yeah.
usually in the evenings it'll go down lower.
And so
Hmm.
that's an interesting thing, isn't it? Like, why is
Hmm.
that? Maybe so. Maybe back in the day, you couldn't actually find anybody because you're like feeling around in the dark, like just
That's
go
why
to
we don't hunt at night.
just go to sleep. That's
Yeah.
so. So the other thing I think about, particularly in the realm of healthcare patients, is the rhythms of tending to things that really help us stay healthy and well. Things like, well, we talked a little bit about eating, and we talked also a little bit about sleeping. But what about things like taking our supplements in the routine of that, the rhythm of making sure that we're staying with our regimen of health and wellness and exercise. Those two things, I think that would be a fun thing to talk about. So maybe we'll talk about exercise first.
Yeah.
How do you look at exercise and this is a totally almost completely polar opposite discussion we'd be having if we were sitting here in January, right? Because
Yeah.
we would be trying to figure out, like, how, at least in this part of the country, how do you get outside to exercise? How do you get to go where you're going? How do
Right.
you not fall down on the sidewalk? Those kind of things.
Yeah.
But in the summertime, it's hot, people are sweaty, the air the air quality has been terrible, across the
No.
country. how do we get the amount of exercise and the proper exercise for us as individuals, like knowing that looks different
Yeah.
during the summer months? What are your
You know,
tips?
I like that question because it reminds me of how I approach patient care as being so individualized still.
Yeah, yeah,
Just like diet, just so exercise in this case is like, well, what do we know about the person? And then how do we see their physiological responses happening? If I have a patient who their cortisol levels are really low in the morning and they're tired and they can't get out of bed, sure, there's like supplementation things you can do. But I usually say, get out of bed and do 30 seconds of super vigorous exercise, which of course does not sound great, but like you can do 30 seconds and that can help bring cortisol levels up
right.
without a pill.
Yep.
And so same thing goes if their cortisol levels are like crashing after work, it's like maybe that's a really good time to get off your butt and go for a walk. You don't need to always think, when do I go to the gym?
Yeah,
But honoring movement with how your goals are trying, like if you're trying to fix something, uh we can insert movement in that context. Now I think it's also important to think about the type of exercise, right? Like you were saying, what if it's winter and it's not safe to run outside? You can do other forms of movement that are safer. Like, yes, walking is a lot safer out. And
yes,
that I'm not super picky about how you move your body. In fact, if I were to say anything about exercise, do different things,
yeah, mix it up.
move your body differently.
Hmm.
Um, and that is what I think is going to create not only more safety, being able to get up off the floor and yada yada, but like also build strength in ways um, that actually creates more connection and communication again up to the brain. So
Right. What about exercising later? So I always try to give the advice that, people have to do what they have to do based on their
yeah,
schedules with their families and their work and things. But um, I see a lot more people in the summertime, obviously running and being outside and doing like pretty significant exercise at like 8:30 p.m.
yeah.
That seems a little counterintuitive based on the diurnal cortisol rhythm. What
Your
do you?
timing for that is really poignant because I
Yeah.
had I evaluated a patient right before this meeting where her cortisol was perfect. And then at 5 o'clock, it was higher than it was in the morning. And I was like, dear, are you okay? Like, she's like, oh, I played soccer. And I was like, but still, I don't expect exercise to create a whole new rhythm of cortisol, at that late in the day. So that begs the question, is your exercise too vigorous for that time of day?
Right.
Is it creating a stress response
Right.
inherently, and so yeah, I love the idea of going for a walk after dinner. I am not interested in going for a run because I'm going to be awake for the next couple
That's the
hours.
thing, right? So we expect the cortisol to rise with exercise. That's a normal response.
Yeah.
But if you're somebody who's struggling a little bit on top of that and you don't clear your cortisol, you're heading into your bedtime with a persistently elevated cortisol level.
Yeah.
Yeah,
Yeah. So mornings really are like generally better to exercise. But again, we factor so many other things into.
totally agree. Yeah, and it's really interesting. There are people who are hard and fast after work exercisers,
Hmm.
who have just always been late in the day exercisers, and it doesn't impact their sleep. And I just
Yeah.
think those are probably people who are very efficient at breaking down that cortisol spike that they get from exercise at 5 p.m. or 6 p.m.
Yeah.
And they're able to normalize it and still go to bed without.
Yeah.
So, so talk about. Do you have any tricks about helping people stay on track with their supplements? I think a lot of what I hear from a lot of my patients in the summertime is, well, I'm sort of not taking much of anything, and some
Right.
people just sort of fall off the wagon on everything,
Yeah.
and supplements is one of those things that they tend to fall off the wagon with. So, what are some
Oh,
things that
yeah.
we can talk about to help people stay on track to make sure that they're taking what's necessary? Maybe they don't need to take as much vitamin D during the summer, but there are certain things that for whatever health conditions they have, they need to be taking all year round.
Hmm.
What do you think about that?
Yeah. I mean, I'm human and I'm a patient, and I would be lying if I said I had all that figured out too. I have one supplement that I'm supposed to be taking before bed, and I even leave the pill out of the butt, like right there. And so
Yeah.
there is not a magic bullet for like having that
No.
routine down, but having your structure generally the same all year round,
Yes.
it can be hard. Like you said earlier, like kids are home, blah, blah, blah. I mean, I
Yeah.
haven't gone to the grocery store in a week and I'm like, how?
Yeah.
So with that kind of rhythm, and it's helpful because when I make treatment plans in clinic, I usually give them a piece of paper that has like a whole graph. And then that way they can put it on the fridge and it says breakfast, lunch, dinner. Other people, they prefer to just put it in a pill box.
Yeah. Get one of
And
those little
so,
Monday through Friday
yeah.
meals.
And if it has morning, afternoon, evening, or whatever, in that way, when it's opened, if it's flipped up, you're like, oh, yep, I already did that.
Yep.
So
That's a great idea.
those are really helpful tools.
Yeah.
Mine is a matter of also thinking about my priority on a daily basis is always food and when I'm eating. And so a lot of my supplements are going to be paired with food, not only for metabolism, like how to absorb them, but it's just what I pair in my mind as like
Yeah.
food then supplements.
Yep.
And
Totally.
so you've got to think like an ADHD brain of like, how do you keep executive functioning on task? And you got to have associations.
Right.
And so in the summertime, yes, it's hard or easy to get off track, but having as much structure in your day and not skipping breakfast or lunch or whatever that's where I go.
For all the reasons that we enumerated earlier around keeping blood sugars level, et cetera. Just keeping your supplements in the same place. This is something I think gets turned upside down a lot when people are doing a lot of traveling, or maybe they're moving between a summer home and a rest of the year home back and forth, or they're taking a week and going up to the woods and staying in a cabin. Just finding a place to reiterate that sort of system, whether it's the pill box. We tend to think about it for medications, but it actually works really well for supplements.
Yeah.
Or having a dedicated spot that's similar to what you have at home. For me, it's a drawer in my kitchen, and then maybe it can be a drawer in another place, even a drawer in a hotel room or something, where you associate those things together. Like, oh, that's where I keep these things, wherever that works. But yeah, that's a tough problem. I think a lot of people just kind of fall by the wayside a little bit. So we want to keep people. It's not that we want people to take lots and lots of supplements, but we do want people to be taking the things that help their health. It's also kind of a good time to sometimes do levels of things if they're measurable, and that sort of reinforces as well.
Yes.
That hey, when you don't do it, your body just goes back to where it was, and you're not getting the health benefits that you've been striving the other 9 months of the year to do.
Right. And this is a great time of year to check on your rhythms prior to the darkness coming in. And you said vitamin D earlier, and I was like, I never let people off the hook on that. That's year round, right?
Yeah,
like, and
if
so
nothing
getting
else, then
your
just for the
levels
habit.
now.
Yeah, no, it's true. Yeah.
When it should be your best.
Well, and most of us are inside. I mean, I don't spend every day outside. I'm in my office.
Yeah.
I mean, I'm outside more obviously, and I have more skin exposed, but I'm still taking vitamin D year round for sure.
Yeah.
It'll just plummet otherwise.
Yep.
Well, that's cool. So last but not least, I want to talk a little bit about maybe just sort of not medical rhythms, but like life rhythms. So we touched a little bit about this throughout the conversation, but how do we manage, I guess, time a little bit better, particularly people who are raising kids and who have kids that are out of school in the summertime, and then the structure, just, everything goes out the window with respect, no matter how old your kids are. My kids are older, but still the structure's out the window. They're eating all my food.
Yes.
Home all day. And
Oh
it does turn things upside down. But even if you don't have kids, I mean, maybe you work from home more, maybe you're taking care of somebody else in your home that's not a child. There's just like a lot of ways for things to kind of go off the rails. So I don't know that we have all the answers to this as fellow working women with kids, but I don't know, maybe you've come up with some things that help.
Yeah, it's this being a parent has shed so much more light on the things that I've always recommended to patients and myself is we have to treat ourselves like babies. It's this idea of like bedtime and waking time. That is the standard first line of treatment for anyone that has concerns about, well, basically anything, because again, going back to cortisol, that rhythm right there is setting the precedent for all your other rhythms. And your discipline around going to sleep and waking up is the most profound treatment. You could take all the herbs, you could even take medications that regulate your cortisol levels, and yet nothing works as well as getting that rhythm of discipline, going to bed and waking up at the same time every day. Now, I know I'm going to a concert tomorrow night. I'm going to stay up past 9 and I'm going to be a little off my rhythm.
That's
But
crazy.
I know. But you know what? Like, the more attuned you are, the easier it is to get back to it. So I don't
Mhm.
expect that going to work on Monday morning is going to be challenging. I mean,
Mhm.
Sunday morning I'll be a little sleepy, but like I'm going to go to bed at the same time as I always do. And again, yes, that's the goal with my kid. It's very difficult in the summer. We get a little looser, but
Mhm.
philosophically, that is number one.
That's totally sage advice. If nothing else, just trying to stay in a sleep pattern. Uh,
Yeah.
that's really helpful.
Yeah.
Getting teenagers to do that, not so
Good
much.
luck. No.
But yeah,
But
little
we
kids,
don't stop telling them.
yeah, you don't. Yeah, they don't believe you, but yeah. But even little kids, kind of trying to keep them on that sleep schedule. I remember being a little kid and being put to bed, and it was still light outside, and I'd be
Oh
very,
yeah.
why am I going to bed so early? And I was going to bed
Yeah.
at the same time. I just didn't realize that it stayed, light out in the summertime when I was 4.
Yeah.
Didn't make any sense to me, but now I get it.
Yeah.
It's
Yeah.
a good idea. Even just trying to, have everyone pitch in a little bit and not necessarily try to recreate the school year necessarily, but having some scheduled activities that's not school, like some
Right.
parents send their kids to camp, daycare or whatever, but then having them continue to have dinner at the same time and try to keep some of the structure of
Yeah.
things intact most days of the week, and understanding that we have more social activities and things that we do.
Sure.
um,
And this idea of moving into telemedicine for work for me has been very good because I still get to be home, but I start something at a
yeah.
certain time every day.
Mhm.
And I found that even at 40 years old, I'm like, wow, if I don't have something scheduled or like to do right
Yeah.
away in the morning, my day's kind of a drag,
Yeah.
And so,
Yeah.
like, if I'm off work or I don't have plans, I'm going to go to the grocery store that morning or I'm
Mhm.
going to go to the park that morning. Like, there has to be something that gives you purpose
Yeah.
to start your day
True. Yeah. Whether
and
you work
honor
or
those
not.
rhythms.
Yeah. That's really important to know, regardless of the time of year. But
Mhm.
yeah, that's true. It's a tough topic, but I think the really solid take home points are just really understanding that cortisol piece and how much of an underlying rhythm that is for all of us, and then how much sleep plays into that because of melatonin, but also just because of modulating that natural rhythmic process and honoring that that's happening in us, whether we want to control it or not. That is how we operate. That is our motherboard,
Yep.
and that is how we operate. So just continuing to honor that year round and not trying to mess with it is really really key, really a key
Yeah.
thing. So, well, thank you, Dr. Alicia McCubbins, for your cool stuff. I always enjoy talking with you, and
Same.
I hope your summer is going well. I
Oh,
can't
yeah.
believe it's almost over.
Stop it. It's
Okay,
not.
I didn't say that out loud.
Halfway, maybe. But
Yeah,
yeah,
we'll,
I
we'll say
mean,
halfway. We're gonna
I
say
have
halfway.
noticed that it's getting a little darker a little bit
No,
earlier.
no, no,
So
no,
these
no. That's not true. That's just simply wrong. That's not true. That is not true. I'm going to ignore that as long as I possibly can. Well,
Love
thanks
it.
for joining me. I really appreciate your wisdom, and we'll see you next time.
Thank you.